All right, welcome back. This is part 2 of the mapping assignment rubric explanation. I still have the mapping assignment that I worked on in the previous video left up here. I encourage you to go back and review that if you aren't watching these two videos back to back. The mapping assignment, just as sort of a refresher, is we're focusing on a patient involving CHF as their primary medical diagnosis, COPD, renal failure, and hypertension as secondary medical diagnoses. This part's going to work on the nursing system aspect of the rubric, numbers 8 through 12, and they flow directly from that patient mapping interaction. All right, so number 8, write one self-care deficit statement. It's going to include a problem, limitations, and supporting physical assessment, subjective and objective data. So here we go. We have a problem statement. The patient's given us a problem of edema, fluid issues. That's what we need to focus on. So our problem statement is going to be fluid volume excess. Fluid volume excess is our problem. Okay? You'll find that in the nursing diagnosis manual, Ackley and Ladwig. I encourage you to purchase that if you don't have it. It's a great resource for these kinds of assignments. It's also a great resource when you get into the field. And honestly, just as a little tangent, I was just talking with a practicing nurse at another facility, and she started laughing when I started mentioning care plans, because when she was in nursing school, and we went to school about the same time, you know, those assignments we laughed at, we did them, we left them alone. All the nurses on the floors said, don't worry about them, you're going to do them for the assignment, and then you'll never see them again. And she started laughing because the care plans, these problem statements, are coming back, and nurses are filling them out electronically on all of their patients, and it's a part of the nursing care to show, are we helping this patient improve or not improve? And it's a great objective measure as to, are we taking this patient in the right direction? So please don't blow off these assignments. There is a reason for them, a very active role. They're playing a very active role in the field currently. And I don't see that going away anytime soon. So here we go. We have fluid volume excess. That's the problem portion of this. Now we have limitations. Now here's a little side note, because as curriculums change and assignments change, you may still be watching this video, but the limitations are going to come from somewhat of a theoretical background. All right, so there's tons of different nursing theories. Currently, the school utilizes Orum's theory. There's other theories out there. NANDA, your Ackley and Ladwig book, does not utilize the Orum theoretical framework, but it also has related tos, limitations. Now, here's the issue. Sometimes your limitations sound like medical diagnosis. So, fluid volume excess related to CHF. That might work for some, but it's not truly getting at a nursing understanding. And that's what Orum's does. That's what some of these nursing theories really do, and that's personally why I like Orum. I used to hate it when I was in school, and I went to UT 10, 12 years ago, but I recognize why she created the theory that she created. It's a beautiful theory to keep a nurse's focus on the patient, not the disease process. So an example would be, and we've given you examples of these limitations off of the bubble dude sheet. Again, on the right-hand side, if you lay it in landscape, there's acting, judging, deciding, limitations that are patient-focused. So, you know, you could have fluid volume excess related to maybe some acting issue. They don't have the energy. Decreased energy for self-care. Okay? So maybe they have decreased energy for self-care. That's something that as a nurse I can possibly address. Energy levels, needs. Maybe it's a motivation. Maybe the patients have, decreased desire to complete self-care. Okay? Maybe it's a desire issue. And again, some of these are directly on that sheet. Some of them may look slightly different. They're very vague in their explanation. Where the specifics come in is in the next step, though. So you have an acting issue, you have a desire, a judgment. Maybe it's a knowledge issue. Acting, maybe they can do it. Judging, they want to do it, but they don't know how. So decreased knowledge about fluid maintenance. Okay? So decreased knowledge about fluid maintenance. Maybe it's a knowledge thing. They don't know how to take care of the edema, how to decrease their sodium intake, how to affect their fluid intake, that kind of stuff. Maybe they just don't know. So these are limitations. You can have 1, 2, 3, probably wouldn't do more than 3. 1 or 2 should be sufficient. And then you have subjective and objective data. Items that directly link back to these issues here. So related to, and then you have an as evidenced by. And I'm going to bring the as evidenced by right down here. And you can write this all out as one statement. Boom, comma, boom, as evidenced by. This as evidenced by are items from your map that are directly linked with these issues. So, and things that maybe the patient stated. I know I didn't put any subjective physical assessment on the map, but I encourage you to do that. It's a part of the assignment. But maybe one of those items that was on there, or could have been on there, was patient states, I don't know how to decrease edema. So maybe they state at point blank, I don't know how to handle this. I don't know what to do to keep my edema down. Maybe their sodium level is elevated. And actually, it could be elevated, it could be decreased too because of dilution. Maybe they've taken a lot of sodium, but they're holding on to a lot of fluid, so it actually dilutes out their sodium. So lab values, sodium lab value, potassium lab value, BUN and creatinine. The BUN and creatinine lab value, which was 44 and 2.4. All right, BUN and creatinine, showing that their kidneys aren't functioning properly. Fluid volume excess because their kidneys aren't functioning properly. Actually put down edema. Edema was +3. And they had pain with that. They have crackles, which has to do with the fluid volume excess. They're on Lasix, 20 milligrams daily, for the excess. Now this could also be an intervention that we could be thinking about. So you'll have to decide how you want to put that together. But a lot of these are going to be your physical assessment pieces. Maybe they put something else. Patient states, I do eat a lot of fast food. Maybe they actually state, I don't know how to handle this. I do eat a lot of fast food, and here's some of my other issues that are going on. So that is number 8. Okay? Number 8. You have a problem statement, you have limitations, 1, 2, 3, something like that, as evidenced by your physical, subjective, and objective data. Then we move on to number 9. Because number 9 is and states write an outcome for the self-care deficit from number 8. A goal, which is opposite of the problem. 3 criteria that are measurable data indicating goal achievement. Target date, expected time for reaching each criterion. So here we go. We're going to take the opposite of number 8 as the problem statement, and that was fluid volume excess. So, fluid volume balance. Because we don't want to take it the other direction. We don't want to go true opposite fluid volume deficit. That's not the opposite. The opposite is fluid volume balance. So that's part A. Part B is 3 criteria measurable data indicating goal achievement. So we now no longer even have a related to, because the related to limitations have been addressed if we achieve this goal. So we're going to do as evidenced by, fluid volume balance is evidenced by, and we can pick 3 of those criterions from the problem statement in number 8 and put them here. So maybe we have, as evidenced by, patient states, I won't eat fast food as much. Okay? Now we would like them to say, I won't eat fast food, because we know what's in it. It's not good for somebody with these conditions, but I won't eat fast food as much. That's number 1. A second one might be, and we would say measurable. That's not truly measurable. So you might want, how about once a week? I will eat fast food only once a week. That's measurable, not as much. It's not as measurable. But that's what the patient said. Now we could get into crackles. No crackles. And how about the edema? That's measurable. Edema plus 1. Now somebody in this condition, we're anticipating them still having edema. They're going to have some edema. We just don't want it plus 3, plus 4, pitting edema. We're satisfied with maybe plus 1 edema or some slight edema. Okay? Crackles, we don't want crackles in their lungs. It affects their oxygenation, and we can address that to the point where they will have next to no crackles or no crackles. So those are measurable data. Okay, no crackles, edema plus 1. You could even say 1 time per week if you wanted to have something more measurable with the fast food. Now we need target dates for each of these. Edema plus 1 by, and you don't want to say discharge. Discharge is a very fluid time frame, because if the doctor decides they need to stick around for a few more days, then that extended out your goal target date. We want to actually pick a date so that we can reevaluate these if they have or haven't been met. And then we can provide them new interventions based on them meeting those goals or not. So pick a date and time. Don't worry about it being right or wrong, or the patient meeting them or not meeting them by these dates. We just want something reasonable. So edema plus 1, today is January 5th. So we'll say plus 1 edema by January 7th. Okay? No crackles by January 6th. We'd like the crackles to go away a lot sooner than the edema even, because of the oxygenation issue. Patient states, I won't eat fast food as much, or I'll eat it once a week. By, we'll say, January 8th. Now you can have the date. I like date and time personally, but a date is satisfactory. So date, you could say by noon. You know, January 7th, noon. January 6th, noon. January 8th, 5 p.m. Okay? A date is perfectly fine. So you've now, for number 9, you've done outcome, goal, your 3 criterion, and the target dates with that. If you want to do more, that's great too. All right, so that's number 9. Number 10. Number 10, identify at least 3 nursing interventions with rationales. Now, 3 nursing interventions, you can pick one for each of them. You could focus in on one. I encourage my students, depending on how an instructor reads this, you could do 3 for each of them. Okay, 3 interventions for each of them. For the first assignment, not so much. Okay, so we've got 1, 2, 3. Now these are typically going to come from Ackley and Ladwig, or your textbook, or notes from class. Okay, the interventions, there's so many interventions for this. You know, explanation of a low sodium diet, explanation of, you know, what's in the contents of fast food and fried food and how that affects your blood pressure and fluid and stuff like that. Crackles, you know, with coughing and deep breathing and helping get the crackles out, making sure that they're taking their medication on time and as prescribed by the doctor. So there's tons of interventions. The important part with this, again, is the rationale. The rationale, even Ackley and Ladwig provides you some rationale. What you don't need to do and what does not benefit your teaching, your learning, is if you just copy, okay? Don't just copy it from the book and go, oh, that's good. Because it still needs to be relevant to your patient. Maybe one of the interventions has to do with a tube feed or an IV or something like that, and your patient wasn't on a tube feed or an IV. That's not relevant to you. Okay, so you still need to look at the interventions, make sure that they're relevant, reword them into your own terminology, and then cite it. Okay, APA format. Cite it. Cite the book. Cite the resource that you're using, because it's not your idea, it's their idea. So you need to give credit where credit is due. And it also, the rubric says use textbooks, use Ackley and Ladwig, okay? But when you use it, you need to cite it. Okay? So that's number 10. Number 11. Number 11 is write a SOAP evaluation, subjective data, objective data, analysis, and plan. Now what I want you to realize is that, I'm going to kind of go back through this real quick, is we started off in video 1 with our admission story, our admission history. That was assessment number 1. You had nothing to do with that assessment. That's on the chart. With the map that we drew out, my discombobulated artistry, CHF, COPD, hypertension, renal failure, all of that is your assessment, is what information you gathered from the chart and the patient while you were taking care of that particular patient. From the map, you figured out what their nursing diagnosis, what priority nursing diagnosis you wanted to deal with directly from the patient. Number 10 is number 8 was the problem, the self-care deficit. Number 9 is your goal statement, what you want the patient to achieve. That came directly off of number 8. Number 10, the interventions to meet number 9, the goal statement. So all the interventions you want to have to meet these criterion, okay, that's all directly from your interactions with the patient. Number 11, for this assignment, sort of steps out of the actual box. because some of these interventions you may or may not have been able to do with the patient. Okay? Treat it as though you were able to do with it. So number 11 is, I'm going to say, semi-hypothetical. Okay? Think realistically with the outcomes and the interventions that the patient would have received and how you perceive that they might have instituted them into their own life. So we want a SOAP note. Okay? This S is subjective data. Okay? That took place after interventions. Okay? So this subjective and O is objective after interventions. Okay? So these items are not from the patient's assessment that you gathered. It's not from the admission story. It's not from the day that you were with the patient. These are, what do you think the patient would have been like after the interventions that you may not have been able to do? Okay? So subjective data. Let's think, based on our criterion. Patient states, I will only eat fast food every other week. Okay? Then we have objective data. Crackles. Slight crackles in bases only. Edema plus 2 lower extremities. So we have patient states, I will only eat fast food every other week, slight crackles in bases only, and the edema of plus 2 lower extremities. A is an analysis. A is not more data. A is simply, did they achieve these criterion or not? Okay? So you could say, for A, B, and C, okay? For each of these different criterion, did the patient achieve criterion A? The criterion was, I will only eat fast food once a week. But they're saying, I will only eat fast food every other week. It's a great goal. If that's the outcome, they would have achieved it. Met goal. Or met criterion. All right? Number 2, slight crackles in bases only. No crackles by January 6th. So the goal was no crackles. They still have slight crackles. It's better than what it was. So partially met. Partially met goal. And then edema plus 2, it was plus 3, we wanted plus 1, we only got plus 2, partially met. Okay? Now if you put all of these together, they only partially met that goal. Okay? That goal statement that we had. But you can break them down into each criterion because that's an encouragement to the patient. If you just say, hey, sorry, you only partially met your goal. No, you met this, that's great, that's awesome. Once every other week, way to go. Hey, you're on your way, partially met crackles and bases only. Edema plus 2. Hey, it was plus 3, you noticed the difference. Keep it up, partially met goal. All right? Now, if their edema was still a +3, then that part would have been goal not met, or not met. Goal. P, plan. Plan is new interventions based on the fact that we meet or not meet these goals. So this is more interventions to help patient. All right? So they only partially met a couple, they met one. The plan is we want more interventions. So you go back to Ackley and Ladwig. You look at a few other interventions that might be beneficial for the patient, and you provide those here. Patient will do X, Y, and Z, all right, by this date and time, okay? So that's number 11. Now number 12, on a separate piece of paper, a separate sheet, in 150 to 200 words, which is a paragraph or two, explain in your own words the interdependent and independent nursing care needed for a patient with this medical diagnosis. You can refer back to your text and see nursing implications and nursing management sections for that. You can also look at Ackley and Ladwig again at the explanations provided there. Now, even though it says in your own words, you're still taking the thoughts of somebody else. So you still need to cite number 12 as well. So within number 12, you're going to have a couple citations from your Lewis text, from your maybe other med-surg text, or Ackley and Ladwig, that kind of thing. So just because you're looking at a book, taking somebody else's thoughts and then making it your own, it's not truly your own because you started with their thoughts. So you still need to cite it. And with that, you need to have a reference page of probably the items from number 10, Ackley and Ladwig, and other items from number 10, and then your number 12, and that would be your references. So in completion, you have your assessment, your admission story assessment from the chart before you ever showed up. You have your mapping assignment that I showed you how to go through step by step based on the rubric. You have number 8, which is your self-care deficit statement, the problem that you want to address. You have number 9, your goal statement. Number 10, your interventions that you're going to help achieve that goal statement. And then think somewhat hypothetical. After the interventions took place, what subjective data and objective data did the patient present to you? Okay? And analysis is, did we meet that goal or not? Or the parts of that goal or not? And then our plan. As a nurse, we're constantly in that nursing process. Assess, diagnosis, plan, interventions, evaluation. We keep going round and round. So we want to make sure that we're providing that patient with more interventions. Here's the thing, you can't cop out of it. Even if met goal, met goal, met goal, perfectly met the goals, there's still other interventions that you can provide the patient to help them continue to meet those goals. So with that, I say have a nice day. If you have any questions, feel free to talk to the course instructor or your clinical associates, clinical instructors, and they can help process through this assignment with you more. Have a nice day.